Squeanakoi, Nakna, Virginia Hedrick, Ayukui. Good afternoon. My name is Virginia Hedrick. I'm the Executive Director of the California Consortium for Urban Indian Health. And we're going to be talking about COVID-19, state of the pandemic. And really today's focus is on childhood vaccines for COVID-19. And I'm joined by two beautiful guests, and I will allow them to introduce themselves.
Good afternoon. My name is Tahira Cunningham. I am a board member at the Sacramento Native American Health Center and a mom of two.
I'm Kirby Cunningham with the Dry Creek Rancheria of Poe Indians, also affiliated with Manchester Point Arena. Currently elected official for the Gaming Commission for Dry Creek.
Thank you both for spending some time this afternoon to chat with me. I know, Tahira, you and I have connected professionally with your role at SNAC. But, you know, the pandemic is an ever-changing thing that we've been tracking. And we're so fortunate now to be in a place in this pandemic where we have a lot of, I feel like, safety guardrails to protect us as communities. One of those is testing. And the other is, well, there's really three things, right? So like testing, vaccines, and then we have antiviral treatments for our most vulnerable folks. But I want to talk a little bit about the COVID-19 vaccine. And I know that you all said that you're parents of two children. And I'm wondering if you can share with me if they are vaccinated and how you, as a family, went about deciding to get them vaccinated.
Yeah, so they are absolutely vaccinated. We are proud vaccinated parents. We got vaccinated as soon as we were able to, earlier in whatever year it was COVID started. I don't even know.
2021.
And we really were quite COVID conservative and stayed home, sheltered in place for the entire time until our children were able to be vaccinated. So they actually did not return to school. We did the virtual learning for a solid 2 years.
Up until January of this year, after the Christmas break, because after they're fully vaccinated, we brought them back to school.
Yeah, which is a whole other interview. But as soon as they were eligible, they're 10 and 7. So as soon as they were eligible for the vaccine, we signed them up and we sent them back in January, and so they were able to complete the school year in person, which was hugely beneficial to them, of course, but it also gave us kind of solace in knowing that they could be there and be safe. We are also maskers, so while they are vaccinated, they are also masked the whole time they're in school except for lunchtime.
Yeah, tell me more about that, because I feel like this is something that there's a lot of confusion around. There was a period of time where masks were mandatory in the state of California and on all federal regulated forms of transportation. So we know this, right? For a period of time, anytime you stepped outside of your house in California, you were required to wear a mask. To enter businesses, you were required to wear a mask. To fly, be on public transportation. And that's not the case statewide anymore. So currently, Alameda County put in effect a mask mandate, I believe on Thursday. LA County issued a mask mandate on Friday, and I haven't heard of any other counties to follow suit yet. But despite there not being mandates, there are people who still wear masks in all of these same scenarios. So can you tell me a little bit about what that means to be a masker?
Yeah, she's really a hardcore masker, but I've been working this whole time. She's been working from home quite a bit. Previous to COVID, I worked remotely twice a week, anyways.
Okay.
So I continue that up. But since this whole time, I work for the casino industry. We've been doing a lot of protocols at the casino, and we've been masked this whole time. My gaming commission, we've been masked the entirety. Even when the mask came off, we still kept them on. Just kind of, I've been tracking numbers. This is part of my new job duty I have to do. It's close contact tracing, all that kind of been a new role that the commission has played in. And just knowing that, we want to make the workplace safe. And the only really way you can guarantee that is, wearing those N95 masks or better. And so, if people don't want to wear the mask outside of work, we don't want to come bring them back and spreading. the president we've had at the workplace, and now that everywhere in the 8 counties around here now on the red, it just shows that stuff's not going where people don't wear the mask. It's going to spread. It's better now that people got vaccines, so you're at least you're not get that sick in theory, but there's still outside chance. You never really know.
And I would just prefer they not get sick, and why not?
Still, it's a 5-day timeout now, either which way. It was 14 days originally, right? You couldn't go to work 14 days, couldn't go to school. Now 5 days was still too much to miss.
So I think as parents, we don't want them to get sick ever. And if masks are the thing, I'm not quite sure if we'll ever take our masks off. That's probably not true. Not true. My kids would kill me if I said that to them. But we've talked to them this whole time about our responsibility, not just to keep ourselves healthy, but also keep our family healthy. They are blessed to still have a great grandma. And a great grandpa. They are blessed to still have grandparents. And so we have responsibility to keep them healthy. And part of that is what we can do to protect them. At the same time, one of my daughters had a teacher who had an infant. The other one had a teacher whose husband was a cancer survivor. So there are just other factors, I think, that required us to be responsible and help support the community. I think we're very conscious of our role in community, and part of that is protecting ourselves, but also playing whatever role we need to play to, be helpful. I think we think that sometimes, I know that the vaccine is an individual choice, but I think it's possible that those that don't get vaccinated feel that those of us that are vaccinated can help protect them, right? The more of us that can surround them that are covered, they can kind of continue to not make that choice. So whatever we can do, right? Whether it's protecting those that choose not to, or protecting those that are vulnerable, and also just keeping ourselves healthy. And now, my oldest, she's 10. She, of course, wanted to take her mask off when all of her friends did.
Oh, yeah.
And we had a couple of difficult conversations. But at the end of the day, her responsibility is to honor our family. And so she's kept her mask on. My youngest is a bit of a COVID.
She's hardcore.
She will not take her mask off, and she sees people with masks off, and she's like, oh, they're going to get sick. And, so she's kind of adapted in a different way. I don't know if that's good or bad, but they just kind of do what they're asked to do. We're pretty lucky to not have defiant kids, I guess. They're not doing things when we don't see that, not taking them off when we're not around.
You raise such a good point that I think is, so often we think about COVID-19 from a personal experience and like, what would happen to me if I got COVID? Like, I'm fully vaccinated, I'm boosted, my children are healthy, all of the things, right? Like, we very much live in an I world in society. Like, what about me? But in our communities and in Indian country, we don't have that luxury of only thinking about us. Like, we really need to be thinking about all of those layers. And I'm just like, really moved by you talking about like grandparents and great grandparents and teachers children's and their households. And it is something that I hope, like, as an Indian person, as we eventually at some point move away from this, that we've changed as a culture, that as like a Western American society, that hopefully some people start to like realize the degrees of connection are deep. And it's not just about your insulated household, that everything we do as humans impacts other humans and the environment and all of the relatives, like, as it moves out. So I just like want to touch on that really incredible point about why to continue to wear masks. And Kirby, you mentioned N95. So for those listening, it's true, there are various masks you can wear. And I always say, like, from a harm reduction standpoint, any mask is better than no mask. So any mask, any mask a person can wear is better than no mask. But there definitely are better masks than others. And really the N95 mask is the gold standard in terms of reducing spread of COVID-19, both from an infected person and from a person who you may be near. And if everyone's wearing an N95 mask, the risk of spread is really pretty low. And we can feel pretty confident in spaces where everyone is masked. when not everyone is masked, that the effectiveness of mask wearing does drop. I shared with you all, I have 5 kids and 4 in elementary school, and the degree to which they wear masks is really the spectrum on what I can get from them. My 12-year-old is such an avid mask wearer. Like, he is still someone who just takes it down to eat and puts it right back up. And the others are less than perfect. My 5-year-old is like, there's no way. So we have these conversations pretty frequently. And I will say that both in California and nationally, we see numbers are steadily rising. The expectation from sort of global and local epidemiologists is that cases will continue to surge. Like, diseases come in waves. It's the natural flow of a disease. It's really the natural flow of most things, right? We're going to ride this wave up, likely all summer. We're not going to expect a dip anytime soon, and we have no reason to believe that human activity will lend into that. We're just now coming out of Memorial Day weekend. So how was it when you got your kids vaccinated? Did they both get vaccinated on the same day? Did you do one first, and how did you decide to do it?
Yeah.
Well, I mean, it was a given.
Yeah.
We had it on the calendar.
They were waiting for it. They had to go to school. They had to get vaccinated. That was our kind of our going rule. And it was November 5th? It was when it first became available.
Thanksgiving, yeah.
Yes, right before Thanksgiving. We did as a family. We got our booster shots.
We took pictures. Yeah. We had everyone with their little Band-Aid.
Yeah.
We made it like something to be proud of.
Yeah.
And it is something to be proud of.
Yeah, definitely. Like, there's a lot of families, a lot of responsible families out there who are doing the same thing. And it was we went to a high school in Woodland. We went to long lines, a lot of people. And yeah, it was a big event for us. The girls really liked it. I remember, I'm old now, but I remember the shots used to hurt back in the day. These things are so small. I mean, the girls didn't even flinch at all.
They were nervous, but then pleasantly surprised.
Yeah.
Painful. Yeah. They had no side effects. I mean, we have been very lucky in how we've experienced COVID. I think we've been really thoughtful in how we've experienced COVID. But they didn't have any side effects. And, because my husband is our COVID czar in the house, because that's what he does 9 to 5, it was really important for him to really talk to them about, this is critical, but you still need to wear your mask. Like, you're not 100% in the clear. We still have responsibilities. You still need to. And I don't think at that time they had the treatment for when you got COVID.
Yeah, no.
So it was just kind of, you are 110% protected now. It was kind of like the way that we talked to them about it. And just going back to your point about community, I think what's important to us, or has been a blessing to us, is for our children to be Native. Blessing that you're Native. Because they are raised in this large family, right? And they have been raised so far to know that their responsibilities is toward that family. And, they saw my husband have difficult conversations with family members, because, the gathering and the being together is a huge part of the community, and really saying, like, hey, right now, you have to stop doing that. And that was really hard on our elders. It was really hard on all of us, right, to be separated. But they really saw him really take the lead in organizing the family and making sure that folks really understood their responsibilities. I mean, when it was Christmas, like, we dropped presents off on doorsteps, like, we were not encouraging gatherings, or, now whether, people do their own thing. But our family really tried to, again, like, not only protect ourselves, but really try to educate our family and just make sure that everyone was holding that shared responsibility, which is something that is, I think, my experience has been, it's something that's really central in the Native community anyway.
Mm-hmm. So what does that look like for you guys now as a family? Because I feel like, you guys are really setting a standard for how you as a family navigate COVID. So as you move into summer, and we know that this is like a popular time for um, many of us to gather in ceremony and just spend time together. What will that look like for you guys?
I think it's really organic, right? I mean, it keeps changing. Information gets more concrete. I mean, there's new stuff that comes out. You got to readjust. I think for the most part, it's being respectful. I think everyone has the opportunity to have to at least protect themselves, right? Um, I think we take more risk only with our loved ones, our family, right? We'll invite them to the house. And generally, when we do these, we open up all the windows. I got filtration in the house, crank those babies up. We try to, have a lot of it outside, but it's kind of a calculate. You got to kind of calculate the risk, do a risk assessment. But ultimately, you don't want to miss out on those valuable relationships and valuable experiences. So you kind of got to. It's a little difficult, but I mean, it can be done. I think, going back to when school started, we actively chose not to send our kids to school. Um, it was, we're gonna soon as our elders got vaccinated, we had a list, right? And we started going down a list, started with the oldest or grandma and aunties, and kept going down the list. And that's what we chose to do. We chose to visit our family members that we've been separated from originally. And so it's kind of been a conscious effort in that. And even now that everyone's vaccinated, and I could say a good portion of our family.
Well, and that is a question,
90-something
right?
percent.
Like, you can come over, but are you vaccinated? And if you're not, then we're staying outside and you're staying over there, Uncle Ross. Just kidding. We have one. We have one that I want to get vaccinated desperately. But I think 90 or so percent of the family is vaccinated, and that's really the only folks that we kind of engage with.
So something that you mentioned, Kirby and Tahira, that I think is important is sort of it being organic. And I think that's something, I hope community hears from this is it's an ever-changing environment. And like literally day by day, week to week, COVID is an ever-changing environment. And it's really hard when you're trying to follow guidance and you have to make these decisions. It's, we're going to set parameters. It's going to be vaccinated. We're going to have windows open. We're going to have filtration. We're asking people to not come if they don't feel well. We're doing all of these things to create the safest environment we can, knowing we are also doing that in our own household. And so it's not like an automatic no, like, no, we're not doing something. Like, it depends. Like, are we all feeling good? Are the family that we're going to visit all feeling good? Is everybody healthy? What's the history of COVID looking like? Because you're right. I think that's the other thing we've learned is like how much like our spirits and like we need other people, like how much we rely on being with family to like be well in other ways, like for our mental health, for our spiritual health, like how much that relies on human connection. And so I just appreciate you sharing ways that you set up safety measures and mechanisms within family. And it is really hard. And we do it too, where we sort of have we're having Thanksgiving dinner, we're having family or Christmas dinner, but you can't bring extra people. It can only be you and your household, and everybody has to be vaccinated. And, if there's anything, if you've been sneezing and you think it's just allergies, we ask that you not come. And that is like so counterculture, right? Like it's so counter to who we are as people. Like pre-pandemic, it's like everybody should come. Everybody should come and gather, and we'll have food for everyone and we will feed everyone. But, like you said, making that list of the people who are like, who are the people I want to see? Who are the people I want to spend time with? And being really intentional with what has proven to be really borrowed and precious time.
And it's hard, right? Like there are negative consequences. Like some of our relationships with family members have changed, right? Like we were ready to get that vaccine when it came out. And, we acknowledge the inequities in its distribution. We acknowledge the inequities and even how quickly a vaccine was created when we know that there are things that could be solved that it seems get kicked down the road, right? Mm-hmm. But, I think that we also just acknowledge too that our choices have had some negative impacts on our some of our familial relationships. And, we don't know when COVID will be over, but we hope that it will be at some point and we can kind of mend some of those bridges because we do need each other, right? So I don't want to convey that we've been super conservative and it's been great for us and our family's just been waiting for us to knock on their door. That has been most of our experience, but there's also been folks that have been slower to get vaccinated, and so we haven't seen them as often, or we've only seen them in certain settings, and that does create strains on relationships, and that is also difficult to manage.
And you're right to note that the modern world has not seen a prioritization of health in the way that we did with COVID.
Yeah.
And I'll say it was definitely uniquely tied to economy, and there is no economy if there's not a working public, right? So a shutdown was absolutely necessary. There's a lot of question right now about should we be shutting down? And I kind of just want to talk a little bit about that. I think our newest daily case count was around 33,000. This is just a few days ago in late May. It's comparable to probably where we were in November 2021, which was a pretty high surge. We got up to 53,000. So we're not quite where we were. And that was a pretty dark time. November 2021, we were seeing ICU beds, at none available, a complete strain on the healthcare system. And I do want to convey to folks that we are in a different situation because of increased vaccinations. And you're right to hear there was a very inequitable distribution of vaccines early on. And we've overcome some of that. We've seen some equity in the distribution of vaccines. We're still getting there. Part of this is talk about why our youngest people need to be vaccinated. And I do understand that folks are like, well, why would I get my kid vaccinated? And maybe you guys can answer this too. Why did you get your kids vaccinated when we're hearing all of the time that kids don't really get sick? The risk of a child getting sick from COVID is really minimal. It's no big deal. And you can still get COVID anyways. So why would you, given those things, get your children vaccinated?
I've been tracking this thing a little bit too much. It's been kind of part of my new life now. But I mean, we were seeing a lot of spread that's happening on site at our workplace. It was coming through the kids. It came with a lot in shared custody situations where the kids are going from household to household, and once it gets to a household, it would outbreak essentially. And so there's definitely the kids were definitely getting it. We had people saying it was the kids that were coming positive. So we knew the kids were able to get it. So it was really, want to give them the best chance, even though the chances are that they're gonna be all right. I mean, it's the same for us too. We have a fairly young, healthy family. We're probably in our best shape we've ever been in a while. I'll tell you the truth. She's been hopping the Peloton. I lost all kinds of weight prior to going into this, and so we've feeling healthy as we've been in quite some time. But it was just a conscious effort, just being good humans, trying to do what's best for the community as a whole. And for myself, honestly, I'm an elected official for the tribe. I just couldn't afford, not being available for 14 days, 5 days. I've done my quarantine when I was first there, and I was losing it. I was on the bed. I was isolated in the room. She'd come and slide some food under the door for me every once in a while. I was losing it. That was back when it was a 14-day quarantine situation.
I think you just don't know. You don't know what's going to happen to your kids. You don't know what's going to happen to yourself. I mean, we definitely read the news articles, however sparse they are, about the healthy adult that didn't make it, right? I don't want to take that chance on my family. When they were babies, we signed them up for all the shots.
Yeah, chickenpox.
There's just no reason to have us suffer if we don't need to, which to your point doesn't mean we can't get it. All those things are still true, but our job as parents is to protect our kids. So I'm gonna do that until the wheels fall off. He's gonna do that until the wheels fall. That's just the jam that we have. So if it's getting the vaccine, we're gonna get the vaccine.
I think you're right. It is about protecting children and giving them our best, whatever that is, right? And sometimes our best is better than other days, and sometimes it's not as good as it was the day before. But that is our responsibility as caretakers, as guardians, and all of the roles that communities raise children, is to give them our best and give them our best shot and protect them in the best, most protective way that we can. And you're 100% right. The COVID-19 vaccine is really that best defense mechanism. And then when you pair it with things like masking and proper screening and making those decisions about what events we'll go to, what events we won't, what dinners we'll host, what we won't. And it's really about, and something I really try to talk a lot about is risk assessment, like in all things risk assessment. And we do it every day, right? Like we all make judgment calls and do risk assessments in so many facets of our life that this should just be added to it. And there are so many things that we can learn from this, right? Like I'm with you on this. My husband and I, we work really hard, and we were pre-pandemic. I think in the March 2020, I was scheduled to be on work travel more days than home. And I was like, this is the month I'm hitting it. Like I'm everywhere this month. And everything came to a stop, like a screeching halt. And I got to spend time with my children that I wouldn't have been there. Like we wouldn't have had these conversations. Our oldest is now 21 and he's living on his own. And man, I'm like so grateful for those 2 years that we just got to like keep him and get to know him like as an adult and to see, like, we wouldn't have had that opportunity. We just wouldn't have. So it is important to like take, for folks who struggle with still following the guidelines. Like I have family members that are like, even 5 days, what am I going to do? And it's like, try to see the upside. Like, what can you do? Like maybe your body just needed this rest anyways. Like you needed to probably just stop. And like, there is this role of like creator and like this greater force that also like helps us navigate, get through life. I did want to give a chance for your daughters to join if they would like. Totally up to you guys. I know we told them that they might.
This is Naima, and Audie's our oldest.
Hi, do you guys want to introduce yourselves? You have to speak up a little bit so we can all hear you.
My name is Naima.
Hi, Naima.
My name is Adriana.
Say it one more time.
Adriana.
Adriana. And how old are you, Adriana?
10.
10. And Naima?
7.5.
7.5. Ooh, you're on the upside of 7. Do you guys remember getting vaccinated for COVID-19?
Yeah. Yeah.
Yeah. Was it just a quick shot in the arm?
Yeah.
Did you feel sick after it all?
No.
Did you have to go back a few weeks later and get a second shot?
Yes.
Yes. And are you excited to say that you're fully vaccinated?
Yes.
Yeah. Have you ever had COVID? Yes.
So we got to talk about that.
Yeah, we got to talk about that.
Yeah.
Yeah. We allowed ourselves to be unmasked around, family.
I think it's like when we talk about calculated risk. We did Christmas last year after they had vaccinated. We just got our boosters. We went to Mexico for family Christmas. 16 of us was it total? And so it was a risk that we were willing to take, it went great while we're there, and then it got kind of hairy at the end, right? But
Yeah.
Everyone did all right? Five of us got it.
It was devastating. I mean, we've had this whole interview about all our protections and all those things, and that's all true and fair. And we were like, yes, vaxxed, boosted, we can finally go be with family.
Real Christmas.
And then we get sick.
Yeah.
Right? And it wasn't that we were super risky. It was when you're taking your mask off for dinner, that's when you got sick.
Yeah.
And so it was pretty, as a mother, I was quite devastated about it. But then, we knew that was part of, as we had this earlier conversation about calculated risk, we knew it was one of them. And we all did fine. I think I got it worse because I took care of everyone everyone, but we all did fine. And, you know, they're signed up for the booster that just was authorized, right? But that is, again, why when we came back and we said you can go to school, you got to keep your mask on. Like, we're not going to get reinfected. We're not going to, like, I don't believe in the immunity little thing. Once you get it, you're cool. I don't know if I totally agree with that. So that was like the other reason why we maintained our masking. And we did switch, right? We had super cute, like you should have seen us in Mexico, cute little masks that matched our outfit. Thank you, Old Navy. And then we were like, okay, N95s, that's the jam.
Yeah.
And so we had to find kid ones. Thank you, Amazon. I hate to thank Amazon, but thank you, Amazon. And it would be easier if those were widely available, right? The kid N95s are not as widely available. You really had to look for those. But yeah.
My family had a really similar experience. So it is true. And to your point, you know, there is some research to support natural immunity, but it's not 100%, never has been 100%. And absolutely, there are folks who suffer the second time worse than the first time of getting COVID, and it does happen. So it is really important, as you said, to continue all protective measures. And it's not like, I think some people, there has been like this, you know, idea out there like, oh, like it's like chickenpox, but it's not like chickenpox, right? Like it's not like a lifetime immunity. And the other thing, like on the note of chickenpox, chickenpox does reemerge later in life. It can reemerge. Yeah. So these things are nothing to be played with. So I want to thank you so much, girls, for sharing time with us and letting me borrow your parents here for a little bit to talk about your family's experience. I really hope that it's helpful to other, you know, youth out there and kids to see you guys go through this and to know that you're safer because of it. And you know, your contribution, I would just want to thank you and honor you as young people for getting vaccinated and doing your part to keep those around you safer. So thank you so much for stepping up to be some of the first young ones to be vaccinated. And for those parents and families out there who have questions, you know, please put them in the chat. We'll follow up with you. You can private message me as always. And I want to thank you, Kirby and Tahira, for spending your Sunday afternoon with me. I know it is family time, but I also know that's when a lot of people have time to listen in and hear these important conversations. So walk cloud from me. I appreciate you guys being so honest and open about your experience as a family navigating this pandemic. So thank you so much.
Thank you.
Yeah, thank you
All right.
so much.
Take care. Bye.
Thank you too.